name is Joseph Malvey, and I am the medical director at Diagnosis Dermatologica, a modern center in the heart of Barcelona. Our journey began in 1998 at Diagnosis Dermatologica with total body photography and digital dermoscopy. We applied this method for the early detection of melanoma in high-risk patients. In 2002, we described the two-step method of digital follow-up. Now this procedure is recommended in the most prominent melanoma guidelines worldwide. With digital follow-up and confocal microscopy for equivocal lesions, we significantly reduced the number of excisions in our patients. Now we achieved a number needed to treat of about 1 melanoma per 3 benign lesions in atypical mole syndrome. The latest advancements in 3D and 2D total body photography with new technologies in polarized light and higher resolution of the photography are a revolution in our field. Additionally, new software capabilities integrating advanced analytics and AI can assist us in the diagnostics of skin cancer and melanoma. This technological revolution also presents challenges in the application and knowledge about these new concepts. We need education and training of our dermatologists and staff members in how to use it. In this video, we will see how we operate at Diagnosis Dermatologica. We will walk you through to our facilities, our technology, we will introduce you to our team, and we will see how is our patient workflow. We will also explain you how we manage the data, the IT and quality assurance that are very relevant to our practice. I hope you will enjoy it. A modern skin cancer diagnostic center requires specific facilities dedicated to this mission, also specific clinical protocols, knowledge about how to use these technologies, and of course a very specialized team including dermatologists, surgeons and technicians, imaging technicians, melanographers that know how to use these technologies.
Welcome to Diagnosis Dermatologica. Our journey begins in the waiting room, a comfortable space designed to ensure our patients feel at ease. Next, we move to the Vectra room, equipped with advanced imaging technology for comprehensive skin imaging with 3D total body photography and advanced analysis with images. We then visit the examination rooms, where our expert dermatologists assess and diagnose skin conditions with precision. In the confocal room, we utilize cutting-edge confocal microscopy for detailed, non-invasive skin examinations. Our surgical room is where specialized procedures, including Mohs surgery, are performed with the utmost care and precision. Finally, we enter the reading room, where our specialists analyze images and data to develop personalized treatment plans. The technologies required after the physical examination of our patients are dermoscopy, total body photography, 2D or 3D, and digital dermoscopy of selected lesions by the dermatologist. Finally, we use information from AI to help the identification of changes and risk scores. If the lesion is suspicious for malignancy, we proceed with the reflectance confocal microscopy examination in equivocal lesions or in the assessment of margins before surgery. The journey of a patient at our center is streamlined and efficient. Upon arrival, patients are greeted by our reception center staff, who assist with appointments and queries. They explain the need for patient consent forms and privacy issues of the examination according to regulatory authorities. The patient is invited to relax at the waiting room, and he's informed that a staff member will introduce themselves and explain the examination procedures they may need. In the Vectra room, a changing room is separated from the examination area. Total body photography is conducted to capture detailed images. The processing of images of the 3D avatar takes a few minutes. Then the patient will wait for the second part of the examination with dermoscopy that is worked in a separate examination room. At the baseline visit of the patient, first the technician captures the 3D whole body photography of the patient. The dermatologist then reviews the whole body images of the patient. The patient sees the dermatologist that performs a full-body skin examination using a dermatoscope to rule out any malignancies. The dermatologist then selects specific lesions for digital dermoscopy. following a protocol that considers both lesion characteristics and the patient's phenotype. The technician then captures the digital dermoscopy images that will need digital follow-up. If additional lesions require photographic documentation, such as lesions on the palms, soles, or scalp, these are also imaged. If there's an equivocal lesion, further examination with reflectance confocal microscopy may be conducted on the same visit. At the end of the session, the dermatologist explains the results and provides recommendations, while addressing any questions. Follow-up visits, including whole-body photography and digital dermoscopy, may be recommended at intervals of 6 or 12 months. For equivocal lesions, a shorter follow-up period may be suggested. If malignancy is suspected, a biopsy is performed either on the same day or within the following days. If the patient was referred by another dermatologist, this is noted in the report for the patient. A standardized digital report is prepared by the technical staff, reviewed and signed by the dermatologist. Through the View My Consult portal, patients can stay connected with their care team. Dermographics Viewer enables patients to track any changes between office visits with a user-friendly interface that provides both overview and close-up images. During follow-up visits, the technician updates the patient's clinical information and follows the imaging protocol using Vectra Whole Body 360 and digital dermatoscopy to document the lesions identified during the previous visit, as well as any lesions located in special anatomical areas, such as the scalp or acral skin. Afterward, the dermatologist reviews all the images, either before or during the physical examination of the patient. Any growth, change in color, or alteration in dermoscopic features of the lesions, as well as the appearance of new lesions, are evaluated. Reflectance confocal microscopy examination of equivocal, new, or changing lesions may be required. At the end, the dermatologist discusses the results with the patient, answers any questions, and explains the final recommendations. A standardized digital report is prepared by the technical staff, reviewed and signed by the dermatologist through the View My Consult portal. At Diagnosis Dermatologica, the imaging staff, also known as melanographers, follow a specialized education program. This program was developed by Professor Puig and Malvehi and includes comprehensive training in skincare recognition, basic dermoscopy, and the two-step method for digital surveillance of patients with atypical mole syndrome. Additionally, these professionals receive specific training in advanced imaging techniques, including 2D and 3D total body photography, digital dermoscopy, confocal microscopy, and the use of dedicated software. This training ensures they are proficient in capturing and analyzing detailed skin images, playing a critical role in the workflow of patients and assisting the staff of dermatologists. A training program at Diagnosis Dermatologica for dermatologists and image technicians, melanographers, and other clinics worldwide is also available. You must take into account all the IT security measures that you must guarantee to your patients. It is important to minimize the risk of data loss and cyber attacks. A 24/7 technical service is essential. At Diagnosis Dermatologica, the evaluation of our work is fundamental. This includes comprehensive quality informatics to assess the cost efficiency of the procedures, economic indicators, clinical outcomes such as examination time, diagnostic and treatment results, and the number needed to biopsy. We also measure patient-reported experience measures, PREMs, and patient-reported outcome measures, PROMs, to ensure patient satisfaction and effective treatment outcomes. Additionally, we track vendor support team interventions, IT issues, and their resolutions. This rigorous evaluation process helps us continually improve our services and maintain the highest standards of patient care.
I hope you enjoyed this journey with us. Diagnostic technology, especially the imaging analytics powered by AI, is evolving faster than ever. We must embrace these technologies when they add value to our practice, all while understanding their benefits and limitations in our diagnostic capabilities. We are proud to serve our patients and look forward to moving ahead together with all of you. If you need a specialized training for your staff or would like a consultation on any of the topics covered in this video, please contact us.